I'm going to switch phones here in a minute. I was wondering, are we going to go right ahead and start at 11, or is there a chance we'll delay until the governor's press conference is completed?
I don't know.
I don't know. I was planning on starting at 11.
Let's start at 11 then. Fine.
Okay.
I'll get
Is Bob on the
Michelle
line?
to save it for me. Hang on just a second. I'll be right back with you.
Okay. Is Bob on the line yet, Nat?
I'm not sure.
We haven't heard from him yet.
I was going to say he's not saying anything, so.
I know. They must not
I'm going to head back to my little office corner of my house and then call in on another phone. It's a little handier to use than this one. That way I can keep reading messages. I'll hang up then call you right back.
Okay.
Okay. When he says he can keep reading messages, does that mean we're not getting his full attention during these meetings?
You think maybe?
Yeah, what's so
I'm
important?
going to use this time to clear up my email inbox. Well, I guess we know where we rank.
Rather low.
Yes. So I don't know where Bob is. Can somebody text him and ask him if he's calling in?
I'll give him a call.
Thank you.
I had emailed him earlier and asked him if he was going to appear or be on the phone, but he didn't reply.
Correct.
Hey, Bob. We're waiting for you to call into the meeting here. Oh. I see. He was still on the listening to the governor's call, but he's calling now.
Okay. I want to be respectful. I know we had at least one position calling in, and I know that his schedule is probably tight. So I was hoping we could take that agenda item first. I was actually planning to take that agenda item first, and respect for his time.
And that would be the second one.
That would be yes,
Okay.
the second agenda item. So is Commissioner Main calling in?
Yes, he should be on the line in a few seconds here.
Okay.
Should be.
And we need one of them.
Can anybody hear me? This
Yes.
is Dr. Pittenger.
Hey,
This
Bob.
is Dr. Lund. I can hear you. I've been getting text messages from several doctors saying they're not able to access the meeting. I've got one, Dr. Atler, he says she's called at least 10 times, getting a busy tone every time. Is there a maximum number of people that can attend this public meeting?
Yes, there is.
Have we maxed out?
We probably have. That's probably why Commissioner Main isn't calling in too. Yeah, we have GoToMeeting, but I haven't tried it yet, and I'm hesitant to do it for the first time here. Who do I have that just joined us?
Hello.
This is Dr. Lund. If you can hear me, I'm the public health officer. I'm with the patient. I don't know if I'll be able to stay tuned.
Hello?
Hello?
Hello? Hi.
Is this Pavan?
I can do it.
From Barrier Hospital?
So, Bob, I'm putting you on speaker here.
So is Commissioner Sweet on the line? No. Hi. Hi. Hold on just a second. We're getting ready to start. We're just trying to figure out our technical issue that we have going on right at this moment.
Yeah, would it be best to get a some sort of go-to meeting call set up and reschedule this for, or suspend, or, push out our start time here for, until after lunch or something. I don't know, just thinking off the top of my head, we're having trouble with the amount of people who are wanting to participate in the call.
Yeah, I'm not sure what everybody's schedule constraints are, but we should be able to get a go-to-meeting set up fairly quickly, and we can host up to 250 on that, which is probably our minimum. So I apologize for doing this. We are going to push this meeting out until 11:30 as we get the go-to-meeting set up. I will. Do you think 11:30 is enough time now for us to get this figured out?
If I'm the one figuring it out, then no, but.
Well, I got the link from IT yesterday for setting up GoToMeeting. So
Right, I mean, I have GoToMeeting set up for my office as well, but I mean, I make my office staff set up meetings for me, so I don't know, I've never done it.
Right.
You know, I think since we're dealing with physician schedules, I think a lot of us have actually cleared our schedule for 11 o'clock. I think postponing it to 12 o'clock actually may end up with fewer participants from the physician side.
And I apologize. You know, one way we can do this is if you guys would like to give public comment and then hang up, we can do that and just go through public comment one after the other. That seems like the quickest and simplest route to me for us to stay on schedule. So if that's acceptable to you, I can just start taking public comment right now. Does that work?
I think that's a good idea.
Okay, seems like the easiest accommodation for everybody. Thank you very much. And if people wouldn't mind hanging up after they make their public comment, you can go to YouTube and stream the meeting. We're live streaming it, and you can hear what everybody's saying. But that would allow other people to get on if they want to make public comments. So with that being said, Dr. Pittenger, you were the first one I talked to. Would you like to go first?
Yes, thank you, Melissa, and
Thank you.
also the rest of the commissioners. I really want to say thank you for engaging with us this week, all three of you, in various different ways. I also want to say thank you. First of all, my name is Basil Pittenger. I'm a physician, internal medicine physician. I'm a small business owner that has also felt the pain of this economic crisis that we're in, and I'm also a front line healthcare provider at Bayer Hospital doing hospital shifts. I want to say thank you also to the commissioners for following Curry, Lincoln, Tillamook, and Clatsop County on April 1st with your action to restrict temporary lodging in motels for 30 days to prevent a big beach swarm, basically. And I'm calling because I would like you to consider extending that until we see what's going to happen with our local curve. I think your actions, your decisive actions on April 1st and other actions by the community have certainly saved lives and have actually helped us as a hospital prepare, not just in terms of timing, but also in terms of PPE and rationing. We are at this place right now where we have a developing curve based on a cluster that started at Shutter Creek. It's possible without the Shutter Creek cluster, we may not have any cases at this point, and because of these actions that you've made. Nobody has a crystal ball, and we're balancing this difficult situation with the economy against the difficult situation with healthcare. But from where I'm standing, I think we need to see what's going to happen with this curve and follow the CDC guidelines as far as reopening our local economy and easing any distancing precautions that we've taken. Because what we've seen is that these are the only effective weapon that we have against this terrible virus. So with that said, I'll go ahead and drop off. I want to once again thank you and urge you to extend the restrictions that you made on April 1st for at least another 2 to 3 weeks until we see which way the curve is going.
Thank you, Dr. Pittenger. Who would like to go next? Dr. Lund, I heard you. Would you like to comment next?
Hi, I'm Dr. Agluri.
Please, thank you.
I'm one of the hospitalists at Bayer Hospital. I'm with Northern Medical Center. So
we're having trouble hearing you, so if you could speak up or closer to your
Can you
mic?
hear me now?
Yes, that's better.
Better.
Could
Can
you
you hear
state
me
your
now?
name again?
Oh, I'm Dr. Ashley, Atluri, and I'm one of the hospitalists at Bay Area Hospital, and I'm also I work with Northern Medical Center. So I just would like to bring here, I would like to thank you for this opportunity, but I also would like you to know that if you have had a chance to the CNN interview with Dr. Fauci yesterday, he clearly stated that we really should not leapfrog the first checkpoint. And I think the CDC and National Institute of Allergy and Infectious Disease has actually come up with a good protocol as to when we should ideally reopen. And according to them, we should have a 14-day period of incremental number of cases, which is not the case in our county right now, especially with having more positive cases and having the shutter-free cluster at this time. So even before the phase one should open, we have to cross a checkpoint to make sure we are in a decremental phase and not in the incremental phase, which is actually the safe and the proven strategy before we reopen. And I think Dr. Fauci who is the national leader that we're all following, and we have to follow science to actually contain this pandemic. Again, we do not have a vaccine. We do not have a very medication that is FDA approved as standard care of treatment. We should follow science. And I think, if we reopen, it is considered leapfrogging. And unfortunately, this will really overwhelm our medical community. So on behalf of our medical fraternity, all I would like to say is please follow science, and whatever decisions you come up with, we'll probably we don't have a choice, but thank you for at least considering to give us a minute to express our concerns.
Thank you so much. We appreciate you taking the time to call in. Any questions? All right.
So is there, have you thought about actually moving the timeline or changing as to what you want to open in phase one, not to open the parks and also motels?
I think phase one, we have not submitted a written reopening plan yet for phase one because we're very much, keeping an eye on what's going on. So the hotels and motels, that was a ban that only the county put in place, and the state never did implement that sort of a ban. It was only the coast, excluding Douglas and Lane counties. And so we just let that lapse as opposed to actually taking action. I think, this discussion is still very much in a state of flux. So we appreciate all the input we can get.
Thank you so much.
Thank you. Who else do I have on the line?
Hi, this is Dr. Tom McAndrew. I'm a family medicine doctor here in this community for 32 years. I'm actually an elected hospital district board member for the last 20 years. I'm not speaking as either of those, but basically as an individual, a citizen, and a physician, asking for a delay in context with the governor's press conference this morning, at least a 2-week delay. As Dr. Pittenger said very eloquently, we have a cluster, we have 21 cases in our community, and we have community spread, and we all want to reopen. There's lots of pressure in terms of the economy and what this is doing to all of us as citizens. But the Bay Area Hospital Medical Executive Committee on Monday night decided in a unanimous decision not to expand our elective services based on the fact that we had these increased cases and we didn't have enough of the critical N95 masks. So my request is let's stay with the governor's recommendation. Give this 2 weeks before we actually reopen as a county. And thank you again for giving us opportunity to address you. Thank you.
Thank you so much, Dr. McAndrew. Any questions for Dr. McAndrew? No? All right. Who else do I have on the line? Anyone who wants to give public comment?
Ah. We have one person here in person who would like to give comment, I believe.
That would be just
Sure,
fine,
okay.
thank you.
Yeah, just briefly, my name's Russ Johnson, I'm the Bay Area Hospital Liaison, and just want to say we understand the many different nuances to this, and it's not a simple decision, and it affects a lot of people's lives. So we're not saying that we're saying open or don't open, that's not our stance, but rather we just want to make sure that we're heard and that it's understood how this tightrope we're walking as far as elective surgeries go. And we rely upon elective surgeries to survive financially. And if we do have an outbreak, that will impact us in a major way. So we just want to make sure we have that open line of communication and trust that you guys will do what you know needs to be done.
Thank you, Russ. If we have questions for the hospital, would you be the appropriate person to be asking them to, or is there someone else?
Yes, at this time, I'm functioning as a liaison for Bay Area Hospital, and if I don't have an answer, I will find it.
Okay. Thank you. Any questions?
Melissa,
Commissioner?
this is John Sweet.
Yes, sir.
Could I ask the last person making public comment to say his name again?
Russ Johnston?
Russell Johnston?
Yes.
Thank you, Russell.
Thank you. Any
Melissa,
questions?
this is Mark. Melissa,
Yeah.
I have a question about the Bay Area Hospital. How many
Sure.
C9 cases are they currently treating?
The question is, how many COVID-19 cases are being treated at the Bay Area Hospital?
Currently, we have no cases. We've had many tests and possibilities. We've had COVID inmate come into the ED at one point. So hospitals, they have to be sick enough to be hospitalized for us to test them or admit them. And so the outbreak that we've had, there hasn't been serious symptoms at this point for them to be admitted.
Thanks. Did you have any other questions, Commissioner May?
Gotta get up mute. Not at this time.
Okay. Anyone else that wants to give public comment? Okay. Thank you so much. Commissioners, discussion. I took this agenda item out of order. This is agenda item number 2. It is a discussion about, I believe it's advertised as a lodging stay ban, but I think it also bears a little more conversation. You know, I think there's been some miscommunication about what exactly we've let lapse and what hasn't. You know, where we're at with getting parks reopened. I believe, you know, this is part of that larger conversation. As I mentioned earlier, the lodging ban was only put into place by a small number of coastal counties. It wasn't the entire coast, and it certainly wasn't all of the state. There wasn't a difference between the prevalence numbers between counties that had a lodging ban and ones that didn't. And frankly, it was a level of bureaucracy that we assigned to one select group of business owners and not to others. And so there were questions for us of whether what we did was appropriate, whether it made a difference. I think absolutely when spring break was in effect and people were rushing to the coast and didn't seem to realize that they were potentially spreading a disease, then it was absolutely necessary to clamp down in that moment and say, hold on, what are you doing? Why are you here? The coast doesn't want you here. And the coast still doesn't want a big influx of visitors. But the question is whether the lodging providers should be having to do that increased level of scrutiny of everybody's motives. So discussion, commissioners, any thoughts that you want to share?
Melissa, this is John. I have a couple, and I'd like to emphasize what you already said, that what we're talking about here is not part of a phase one economic reopening. This is something completely different. Our county took the extra precaution of closing our hotel motel down at the 1st of April, not because we were having a problem, but because other counties that were having problems were closing their hotels and motels, and we were concerned that the people that were the guests, the tourists that were overwhelming those counties would end up being here in Coos County. I think it was a very good precaution. We gave it an ending date. I acknowledge that we do have some new cases in the county. That's very bothersome to me. But as Melissa said, there doesn't seem to be a relationship between having hotels and motels open in the various other counties around the state, most of which are wide open to travelers. And so I'm having a hard time justifying that hotels and motels reopening will create a big problem. I want to reiterate that this is not, here, let me go on. I'm sorry, I'm wandering here a bit. We're not talking about parks today. We are hoping to be able to reopen our parks, but we are not on a schedule to do that. I think that were hotels and motels being opened, that OHA would have taken a stand against them because they're open throughout the state, but they have not. At this point in time, I'm not one. It's just a question I have. I've been told that we have adequate surge capacity to accommodate an increase in any medical problem. We're laying medical people off, I understand. So one would think that would be a measure that would indicate we do have that surge capacity. I really wish I'd known of the concerns the medical community has earlier in the process. We've all known for a month, or could have known, that this order closing motels and hotels was due to lapse midnight last night, and it seems like it's kind of late in the game here, a day or two, even the day before the order lapsed, to suddenly be notified of these concerns. And I think it's inequitable to reverse our decision to let the order lapse at this point. So I am not for letting it lapse, and when I say this with all due respect for the input that we've had from our medical community. I know the people that are talking by and large, and I have the deepest respect for them, and I hope that respect can go both ways. Thank you so much.
Thank you, Commissioner. Commissioner May?
In addition to what both Commissioner Cribbins and Commissioner John Sweden said, our order had many exceptions to it, one of which was all essential workers were excluded. The excluded from our order. Also, RV, long-term stay people, 30 days or longer, were excluded, and people who could not find shelter, immediate shelter, were accepted. So that left kind of a narrow window of folks that weren't allowed to go to hotel, motel, or bring their RV in for, like, say, 2 or 3 days. Thank you.
Okay. Anything else?
One thing more I'd like to add, I hope, I don't know if I alluded to this or not, but I track the daily, I know we've had an incident, more incidents here recently than we'd like, but I track the new occurrence of new confirmed cases daily throughout the state, and I've noticed as I watch that, and there may be some inaccuracies in my number, but I think they're pretty doggone close. Early March, we had no cases. For the first, between the week of between March 4 and March 10, averaged 2 cases per day. The next week it went to 4. After that it went to 19 cases per day. Then it bounced up to 57, and then to 80. I beg your pardon. Then to 70. The first week of April, we had 70 new cases a day average, and then it started decreasing throughout the state. It dropped from 70 to 58 the last week. The week after that, it dropped again to 55 new cases a day, and then the last week of April to 53 new cases a day. So we are doing a good job in the state, and we are seeing the new cases diminish day by day. I hope that continues. I guess it just gives me some comfort that that we have room to do what we're suggesting.
Thank you, Commissioner. I don't think any of the commissioners are saying or indicating, that we're not going to continue to keep an eye on this. And as a matter of fact, we attend the emergency operations calls every day with Coos Health and Wellness, and we've been on the phone with our state and federal legislators and have been very, very closely monitoring the situation. I told a commissioner from another county this morning that the lodging decisions have frankly been the hardest decisions that I've made during this whole crisis, and I know my fellow commissioners feel the same way. So, as for me, Commissioner Sweet, Commissioner Maine, I think we're all on the same page. We deeply respect the people that have called us and have emailed us and have made comments, and we're listening to every single comment we get, and know that this is a very, very tough choice. But at this time, I would just add it to the agenda again for next week. Take a look at it again. And I would like us to look at the idea of setting up GoToMeeting, because it would be nice if we could see each other.
Madam Chair?
Yes, sir.
I'd like to also put on the agenda for next Monday, ORS 433.121 about quarantining, specifically pointed at Shutter Creek.
Is that the only statute
what
you
we
want to
can
put on
do
the
to
agenda? Do you
stop
have any
people.
other statutes that you'd like to?
What? Say what? I didn't hear you.
I want to know if you had any other statutes you wanted to put on the agenda, or just the one.
Just that one. Just that.
Okay.
That's quarantine that we can do as the public health authority in the county. You can't believe how, lack of a better term, mad, upset, whatever, with the precautions that weren't done at Shutter Creek, in my estimation. and I'd like to talk about possibly quarantining that whole facility
I have
on Monday.
Well, I have this actually as a discussion for today. Certainly, we can talk about it on Monday as well.
All right, too, but I don't think
and-
we'll make a decision today, but it'd be good to discuss it today with the district attorney. He's already talked to one of the judges, the circuit court judges, about it. Anyway, it doesn't set well with me, as you can tell. I'm off.
Absolutely. So, back to agenda item number 1.
Correct. And I think
Thank you,
we're done with number 2, so it's a good segue to move right on to number 1. And so discussion regarding the Shutters Creek COVID-19 outbreak status and related issues such as communication with Coos County Public Health and officials regarding individuals who are being released from Shutters Creek, as I know we've had some issues with that. Before we go further into the discussion and I open it up for everyone else, I do want to say that while ORS 433.121 grants broad authority to the public health director / public health administrator to quarantine individuals or group of individuals who may pose a imminent public health risk to the public, a subsequent statute, ORS 433.180(2), I believe it is, states that a quarantine cannot take place at a jail, prison, or other facility in which people convicted of a crime are lodged. So certainly the DOC can take should be, taking precautions about who is being released, how they're having people interact within that facility, but to actually effectuate a quarantine at that facility of people who should be released or anyone else is not something that is going to be allowed under the quarantine statute, which would essentially allow us to quarantine people anywhere except for there. So
Yeah, but it also says that unless they pose a threat.
an imminent threat to someone in
This pandemic would be an imminent threat to everybody else in that prison, whether they're a prisoner or a employee.
That's not the way I read the statute. This is Paul Frazier. The statute, that exception you're referring to, says the person or group of persons represents an immediate and serious physical threat to the staff or physical facilities of the hospital or other facility in which the person or group of persons has been confined. In my discussions with people up north who are more familiar with these statutes than I am, this was intended to for people who are being combative, whether it's because of their mental condition or that's just the way they are, that they are combative and pose a physical threat in terms of they're going to hurt someone. Then you can quarantine them in the jail. But you would have to look at it on an individual basis. Do we have a group of people at Shutters Creek that are being combative, that would be a danger, a physical danger to staff? And if they if there is no physical danger to staff in terms of assaultive behavior, I don't think this part of that statute would apply to just, well, they've got COVID and they're a threat to everybody. No, there's got to be more. They have to be a physical threat.
Well, I guess it would be up to the judge because, to me, whether you're beating on somebody or actually giving them disease, it seems to be similar.
Well, I guess I would disagree with that, but
Well, and just my 2 cents on it would be that if the statute is specifically written for the quarantine and isolation of individuals who do have communicable diseases, so if a communicable disease itself would be enough to say that the individual could be isolated in a prison because they represent a physical threat to staff, then it would sort of render the restriction on isolating them in prison facilities meaningless, because we could say that everyone with a communicable disease represents a threat in that circumstance. So I would be inclined to think of this along the lines of what the district attorney, Paul Frazier, has put forth. I will say too that we had a conversation, and I know Paul has had some conversations with attorney for the state, and we've had some conversations with the state, and it appears to me that some progress is being made on making sure that a similar situation to what happened, unfortunately, this week isn't going to happen again. And I know, for example, in Shutters Creek, I don't think we have releases scheduled anytime in the near future, but Paul knows more about that than I do.
Well, the other thing I would add in my discussions yesterday with General Counsel with the Department of Corrections and so forth, first of all, the local health authority does have the ability to, on its own, quarantine people and what have you. But you folks wrote a policy that said you would, in which your policy states that you want the health department to go to court first before they use their extraordinary power to do this without court authority. And so your county policy in and of itself says right off the bat you go to court first to try to get the quarantine order versus having the health authority do it up front. Secondly, though, even if the health authority were to say, yes, let's quarantine Shutters Creek, that order is only good for a short period of time, I believe 72 hours. And then you would have to go to court on top of that. So the health authority going out and imposing this would only have a short-term life to it. The other thing is, if we were to try to do this, I can guarantee you that we will have the Oregon Department of Justice down here full force in court fighting this thing, and I think it's a losing proposition to try to quarantine Shutters Creek, given the statutory framework.
Well, you're correct in the 72 hours, then you have to go to the judge and get it extended. However, the point is to bring a big statewide attention on Shutter Creek and basically shut them down so they don't continue to infect our population that have no cases.
Okay. Might I point out something else at this point? There's a bigger ramification here that I think people need to also realize, is that if you were to be successful in shutting down Shutters Creek, all those inmates would have to be moved to another facility. And that would give the Department of Corrections no choice but to go to the governor and say, we need to make a mass release of inmates from the Department of Corrections. And we've already seen that the governor has asked for a list, and the Department of Corrections has submitted to the governor's office in the last few weeks lists of up to 6,000 people, the last I heard, who the Departments of Corrections would say, if we have to do mass release, Governor, these are the people that we're going to release. I think we need to be very careful how we handle this, because we could end up putting the Department of Corrections in a position where they will have to go to the governor and say, we don't have the space for these people if we have to shut a facility down to clean it or whatever it has to be. And it's just, this could have far-reaching ramifications than what is intended.
Well, as I understand it, they're already releasing 400 a day.
Well, and that may be the normal thing.
That means
I mean, we have
in 100 days, that'd be 400,000. They don't have that many in prison.
Well, first of all, I don't know where that stat's coming from because I've not seen it. And my association has not seen that.
All right.
Because I can guarantee you that if there were 400 people being released today, the District Attorneys Association, if it wasn't that they sentences were being served, if there were 400 people just being released willy-nilly, there would be people griping about it, and we have not seen that, in my association at least.
I got that from a phone conference here last week. But beyond that, they're sending all of their cases, in other words, the inmates, back to Coffee Creek.
That's my understanding, is that they're going to Coffee Creek because they have better hospital facilities there, and I also understand they have what they call negative pressure cells there, which helps keeps the spread of the disease.
And they're down to what? I don't have this exactly secured, but I understand they're only at about half populated right now at Shutter Creek.
That could very well be, I don't know.
This is John. I'd like to weigh in a bit. As disturbed as I am with the Department of Corrections and how, in my view, they grossly mismanaged this whole situation. At this point in time, from what I gathered this morning at the public health call-in, they are taking additional steps to better manage the situation. I do believe there's been a good deal of pressure put on them by not only the county commissioners, but other elected officials at the state level. And I think we ought to give this a little more time. It sounds as though quarantining may not even be a remedy available to us, but whatever. My sense is that they have taken some steps, and hopefully will take more to slow the spread, hopefully eliminate the spread of the virus at the facility. And I'd like to give them a little more time or give ourselves a little more time to see the impact of the new measures they have implemented.
Well, for me, I just think that I can't imagine the gross mismanagement. The management hasn't changed, so I don't have any faith in them. My personal opinion.
Bob, I absolutely agree with you, but I think we need to give them a little more time. They appear to have, the pressure that has been put on them appears to be causing them to change some of the things they've been mismanaging.
This is Paul Frazier again, and just so everybody's aware, I am working with the General Counsel of the Department of Corrections. We've got a kind of a rough idea of where we want to go here. I anticipate hopefully by Monday we'll have something in writing, but in general terms, what we have talked about, and which I believe the Department of Corrections is willing to do, is that we will be getting advance notice of who is going to be released from Shutters Creek into Coos County. In other words, an adult in custody who is a Coos County inmate that is there because of an Coos County sentence. We will be getting advance notice about that person, and with sufficient time so that the health department will be able to, if need be, go to the prison, meet with the inmate, adult in custody beforehand, advise them about going into quarantine and so forth. We're going to get this advance notice. And in fact, I have already received through parole and probation, I have already received a list of people that are Coos County adults in custody that are due to be released between now and the end of September, or excuse me, end of August, I think, or maybe it is September. In any event, we know who those people are. I gave today to the health department a list of people that have been given to me by the Department of Corrections to the health department, a list of people that are going to be released from Shutters Creek between now and the end of June. There's nobody from Coos County that's scheduled to be released in May. There are other inmates that are Coos County adults in custody prisoners that are being released from other facilities that have COVID in it. In particular, I've identified inmates that will be released from the penitentiary. They don't have any COVID cases in the population, but they do have employees that have tested positive. We have several, I think 2 inmates in May that'll be coming out of the penitentiary. We have another inmate that's going to be coming out of Two Rivers, which is over by Umatilla, and they have, I think, 1 or 2 cases in general population with COVID, and that inmate will be released back to Coos County, I believe, in either late May or early June. And then the rest of the people we'll be talking about are coming out of Shutters Creek. There is one person that's in the female side of Coffee Creek. They have no COVID cases in the female side of that facility, and they do not have any COVID cases in the intake center. So when you look at the Coffee Creek on their website, they don't list Coffee Creek as having COVID cases among the general populations there. Of course, that's where the hospital facility is, and that's where the people are going that have been tested. So I've added that person. It's a female that will be released at the end of June. I've added that person to the list so that Coos Health and Wellness already has the names of these people. I also have the names of 7 inmates that have been released from Shutters Creek into Coos County since March the 16th through, I think, the 29th of April. Parole and probation are going to get me their addresses, and then when I get that information, I'll be passing that on to Coos Health and Wellness so that they can then go and follow up with those individuals. Now, if we have individuals, my plan is, and I think the health department plan is, if we have individuals who are not willing to self-quarantine for 14 days once they come out, or if they say, yeah, we will, but then when we check up, they're not, then we will go down the involuntary quarantine process, and we will go that route.
This is John again. It occurs to me that it would be better, I don't know whether DOC can do this or not, if they, when they know that someone's is due for release, is there any way they could be isolated before they're released? You know, people are not in jail because they like to follow society's rules. And so to release them and then expect them to isolate themselves is kind of high expectation in many instances for them.
Well, and that's an issue, and I think it's going to depend on the facility and what they have available to them. How do you have the capability of separating a group of inmates away from general population? Because you also have to remember, at Shutters Creek, not only do they have prisoners that are going to be released back into Coos County, but they have prisoners that are going to be released into other counties. They're going to go back to the other counties. So we're not talking about 5 or 6 people. We may be talking about 15, 20 or more people a month. And I don't know that an individual facility can do that. In one of the meetings I was in yesterday, we had discussions about whether or not we could get one of those rapid testing units. And it seems to me if we could get one of those rapid testing units here in Coos County, that would be a super way to help in this situation because, say, the day before they're to be released, we can do the rapid test, which, if I understand it correctly, you can get a result back in 15 minutes or something. If we, know that they've got the virus based on that test given just before they go, that gives us more information and more leeway into how to deal with this person once they get out. Because even if you quarantine them, I guess quarantining them or if you separate them, you're still going to have a group there, and there's always the possibility that there's going to be somebody that's going to be in that group that's asymptomatic, and the next thing you know, you're back where you started.
Yeah, I just, somehow or another, it just strikes me there should be a better solution than expecting them to isolate themselves once they're released.
Well, I mean, that's a problem you're going to have across the board because once their sentence is up, DOC's got to turn them loose.
Yeah, I understand that.
Yeah.
That's why I was suggesting pre-release isolation.
But then you're faced with, okay, what are you going to do with them if they do test positive? We're still going to be faced with having to, we have to give them the opportunity under the statute. We have to show to the court that voluntary quarantining doesn't work or won't work for this guy if we're going to get a court order to do it. So, I mean, we still have to give them the opportunity to live up to their responsibilities, and then if they don't, then we can get the involuntary order.
They got more rights than those people on the cruise ships.
All right, any other discussion on this topic? No?
Nope.
All right, thank you very much. Nat?
Yes, so the last thing I have, which is pretty stress-free compared to a lot of topics we end up having to discuss, and that's just...
I don't believe you.
Yeah, it is. It's resolution 2004-079L, which I sent out to everyone. It's in the matter of adopting a temporary floating holiday rollover policy in response to the COVID-19 outbreak. We discussed this and it was approved in our last meeting, I believe it was, and this is just the resolution putting that into effect. It's effective through June 30th, 2021. It basically just allows people to roll over their floating holidays from this year into the next fiscal year that's coming up here shortly.
Okay. Do we have a motion to approve?
Approve the resolution you just discussed.
2004-079L.
That's the one.
Yep.
All right, do I have a second? I'll second it. Any further discussion? All those in favor?
Aye.
Aye.
Mute. Aye.
That's okay.
I
Opposed?
seconded 3 times.
Let the record reflect that it was seconded by Bob Main. Yeah,
3 times.
3 times as well.
Okay.
So.
All right,
Yeah,
then
with
the
the
motion
mute.
carries.
So that's the only additional follow-up item that I have. So I guess I'll turn it over to you all if there's any other topics that we've talked about in past meetings that we have any updates on.
Well, I'd like to follow up with what District Attorney Paul Frazier said was trying to get a rapid test machine for at least testing people coming out of the prisons.
This is Gabe. Philip Nell over at Health and Wellness and I talked about it. They are trying to order one through the Ops Center. They are, of course, on back order, but I think we got ours in pretty
I
early.
can't hear that.
Come up to the.
This is Gabe, sorry. I talked to Philip Nell about it. We talked a couple days ago. We got our order into Ops Center fairly early, but there is a back order on them. I don't think we know where we are in the queue, but we're trying to get at least one.
So we have an order in for a rapid testing unit, and it's just a matter of when one becomes available for us to get. So
And I think right now the plan, when and if we do get one, is to try to co-locate it with Bay Area Hospital to help with the surge and make that a testing site, if I'm not mistaken.
Yeah, the way the hospitals use that rapid test, those tests cannot determine if someone is positive or negative. It can determine if they are likely positive or negative. And the way hospitals are using that, it gives them a heads up, and then if it is likely that they are positive, then they will run through the state lab and get the confirmed results. But it does help protect staff. It helps us understand who should be sidelined in a sense, and it just is a good situation for hospitals. So we are very much wanting to have that allocated to us. Right now we're using Gold Beach. Curry General has one. We had no confirmed cases when their first allocation went out to the counties, so we did not receive one. Curry did, and we're currently using them right now for some of that Abbott ID rapid testing.
Thank you. Anything else?
Nothing else from me. Commissioners Main or Sweet?
Nothing?
Not for me. No.
All right.
Have a good
With
weekend.
that, we are adjourned. Thank you.